Good afternoon, dear students. Let's move on to part 2 of lipid metabolism now. Hope you all have understood how fatty acids are getting oxidized through beta oxidation pathway and what is the significance of beta oxidation pathway. Now let's move on to the next stage of lipid metabolism in this class. So in the part 2 of lipid metabolism, we are going to discuss about formation and utilization of ketone bodies and what is ketoacidosis, how ketone bodies are formed and utilized in the body, and what is ketoacidosis, that is due to ketone bodies. Let's move on to formation and utilization of ketone bodies. Before seeing that, let's see what are ketone bodies. Where do they produce? They produce in the mitochondria of liver cells. What is the precursor for ketone bodies production? Acetyl-CoA. What chemical is the precursor? Acetyl-CoA. Where we have seen this acetyl-CoA? It involves in Krebs cycle. It is the precursor for Krebs cycle also, along with oxaloacetate. And what is the significance of ketone bodies? Ketone bodies enter blood to provide energy. Where it provides energy? To heart tissue and during starvation to the brain. What are the ketone bodies? What are they? They are 3 water-soluble chemicals, namely acetone, acetoacetate and beta-hydroxybutyrate, where beta-hydroxybutyrate is not a true ketone. What is the fate of acetone? Acetone cannot be converted back to acetyl-CoA as like acetoacetate and beta-hydroxybutyrate. Hence, acetone will be excreted in the urine or breathed out. How does ketone bodies produce? During prolonged starvation, fasting and in diabetes, these conditions ketone bodies produce. And during this condition, depletion of oxaloacetate in liver occur due to gluconeogenesis pathway. Depletion of oxaloacetate in liver occurs due to gluconeogenesis, which stops the entry of acetyl-CoA into Krebs cycle. Hence, conversion of acetyl-CoA into ketone bodies take place in the liver. Here you can find the combined pathway of formation and utilization of ketone bodies, where in the formation you can observe the precursor is acetyl-CoA of 2 molecules and they get condensed to form acetoacetyl-CoA by means of thiolase enzyme. Then by means of HMG-CoA synthase, beta-methyl glutaryl-CoA, that is HMG-CoA, is formed, and by means of HMG-CoA lyase, acetoacetate is formed. This is the first ketone body formed from acetyl-CoA. From acetoacetate, the irreversible product is formed as acetone, and the reversible product is beta-hydroxybutyrate. Hence the process is reversed. It may be forming again back to the acetyl-CoA. So beta-hydroxybutyrate is the end product of formation of ketone bodies, where acetone is irreversible product and it may be excreted in urine or it may be breathed out from the body, where beta-hydroxybutyrate and acetoacetate will involve in utilization of ketone bodies by the body, where beta-hydroxybutyrate is converted to acetoacetate. See that with the same enzyme, that is beta-hydroxybutyrate dehydrogenase. Due to oxidative phosphorylation process, it is converted back to acetoacetate, then to acetoacetyl-CoA by means of CoA transferase, where succinyl-CoA is used and it is converted to succinate. And this activated acetoacetyl-CoA by means of thiolase enzyme, it is converted to 2 molecules of acetyl-CoA. So acetyl-CoA is reformed back, and this acetyl-CoA enters in Krebs cycle along with oxaloacetate for production of ATP through Krebs cycle. This pathway represents ketogenesis. What is ketogenesis? Formation of ketone bodies. As we have discussed in the last slide, formation of ketone bodies from acetyl-CoA to acetoacetate, acetone and beta hydroxybutyrate is the pathway of ketogenesis, where utilization of ketone bodies called as ketolysis, and this is the pathway represents ketolysis, where beta hydroxybutyrate is converted to acetoacetate, then to acetoacetyl-CoA and to acetyl-CoA, and acetyl-CoA is reutilized for the energy production through Krebs cycle. And this pathway represents formation and utilization of ketone bodies, which involves in energy production as ATP. As we have discussed, formed ketone bodies, then again reutilized to form acetyl-CoA, and this acetyl-CoA enters in TCA cycle, and by means of oxidative phosphorylation in ETC chain in the mitochondria, it produces ATP. Let's move on to the second part of today's discussion, that is ketoacidosis. It is otherwise known as diabetic ketoacidosis, that is DKA. What is DKA? It is a serious complication of type 1 diabetes, and it may be the first sign of type 1 diabetes. It is due to the very high blood pressure which causes buildup of acidic substances called ketones. And it occurs due to lack of insulin production by the beta cells of pancreas. Lack of insulin production by the beta cells of pancreas. As already we have discussed under diabetes mellitus, the type 1 diabetes is due to insufficient production of insulin by means of beta cells of pancreas, and which leads diabetic ketoacidosis. What are the symptoms of diabetic ketoacidosis? Frequent urination, extreme thirst, high blood sugar levels, high levels of ketones in the urine, nausea or vomiting, abdominal pain, confusion, fruity smelling breath, a flushed face, fatigue, rapid breathing, dry mouth and skin. So these are all the symptoms of diabetic ketoacidosis. Let's see the causes of diabetic ketoacidosis. It is caused by illness or infection, missing an insulin injection or not injecting enough insulin, a clog occurs in one's insulin pump. For people who are using one syringe or one pump, a clog occurs in that. Due to that also DKA can be developed. So what are the causes? Illness or infection, missing an insulin injection or not injecting enough insulin, a clog in one's insulin pump when you use one pump all the time. How DKA is treated? By means of 3 processes. First is fluid replacement due to dehydration, then insulin therapy due to lack of insulin production, then electrolyte replacement. This is also to meet the requirement of dehydration in the body. So what are the treatment methods? Fluid replacement, insulin therapy and electrolyte replacement. Since it is a severe complication, we need to follow all these treatment methods. Let's see who is at risk for diabetic ketoacidosis. Those who have type 1 diabetes, and those who are under the age of 19 and who have had some form of trauma, either emotional or physical, then who are stressed and who have a high fever and who have had a heart attack or stroke and who smoke and who have a drug or alcohol addiction. So these will be having or they are risk for diabetic ketoacidosis. How diabetic ketoacidosis is diagnosed? It is by means of 4 methods, primarily urine test, then blood test, then arterial blood gas analysis, then chest x-ray. Urine test is the first step for diagnosing DKA, and blood test is carried out to assess metabolic function. Then arterial blood gas is analyzed to determine its acidity. Then chest x-ray is studied to look for signs of an infection such as pneumonia. So these are the diagnostic methods. And with this we are coming to the end of today's discussion on formation and utilization of ketone bodies and ketoacidosis. In the next class we'll be seeing about part 3 of lipid metabolism. So till now we have covered beta oxidation and about ketone bodies. Thank you all for patient listening.